or good evening, everybody. Let me pull this up. Okay.
You want to expand it?
Yep. Okay. Does that look okay?
We are seeing like at the second, yeah.
There you go. All right. All right. So we'll go ahead and get started.
Uh,
Um,
we
so
we are
start.
seeing, yeah, we are not seeing the yeah, right now. It's okay. Yeah, thank you.
You are seeing everything okay?
Yes, thank you.
Okay. So, for those of you who have been tuned in for some of the talks, at least that I've given, I know there have been a few others. We're going to focus today more on body condition scoring and how that affects reproductive success. A little bit of this early stuff is going to be a review of points that I talked on in previous lectures that I gave, but I was going to expand upon it a little bit more using some data that I was able to find in the literature, just to kind of reiterate those points about how our body condition scoring and nutrition affects reproductive success. And then I was also going to talk on a new topic that we haven't covered, which is in regards to nutrition and body condition score, how it affects kind of in the gestational period, with a little bit of a focus on things like pregnancy toxemia. So just putting up some slides that you should have already seen before, because I've covered some of this of, where does this all begin when we're starting to dig into our programs and figure out where can we improve? And it always starts with looking backwards at what our reproductive performance in the past has been. So looking at what our cycling rate's been, how many females that we saw got mated or got marked during the breeding season, and then how many actually got pregnant. And then going along with that of how many, since these are animals that are likely to have twins, triplets, we also want to know how many lambs were born per lambing or per exposure as a means to determine, how are we doing performance wise? Because obviously, ideal is to at least have twins, because then you're going to, if you're doing this for production purposes, you have double the opportunity to make some money off of the babies. And so, if we are seeing any outcomes that are undesirable, again, this is another slide that you've already seen of where do we start with trying to determine where is the problem. And, first is, are we looking at an individual animal problem, which is our smaller herds, versus is this a big herd problem of things, of pregnancy rates not being good and whatnot. So looking at that history is really important. If we have evaluated what their estrous cycle patterns are like, that can provide a lot of information. But then what I'm going to cover most on today is in the husbandry section of looking at, are we doing a good job with our nutrition program? Because it all starts with them being of adequate body condition score for what stage of the breeding program that they're in. So this is where I highlighted this point. And this is probably the third or fourth time I put this on here, but it is really important to understand what exactly we're looking for when we do our body condition score. And the easiest thing with small ruminants is to palpate kind of along this back area, and this is where we're looking at it from behind. And you're looking at kind of a nice little bit of fat cover. So you don't want it kind of protruding out. You want it more kind of just like a gentle protrusion in some situation. And so that would kind of put you at a 3. And then in some situations where there's a little bit of a divot, kind of would put you at a 2. And then some anywhere in between those. I've got the charts on the next one, but this is where we're palpating. So here you can see I've got the goat one again. These have been in previous slides, and obviously I will send these slides also. But again, just looking at this back end, of how much of a kind of concave versus a convex appearance we're seeing in the back. And then we're also kind of looking at when we are feeling things like vertebrae and looking at ribs. We want to be able to see kind of minimum ribs. It might take a little pressure to put on them. So somewhere between there, most of what we want are going to be in between a 2 and 4. Anything that's a 1 is extremely malnourished, and anything that's a 5 is well over conditioned. So depending on what their life stage is, somewhere between a 2 and 4 is where we're finding is ideal. So just kind of a reminder about the males is we talked about how we would like the males to enter the breeding season, what we say well fleshed, so somewhere between a 3 to 4, out of again, the 5 scale that I just showed you. And the reason for that is that they are so busy during the breeding season that their voluntary feed intake goes down and they can lose a lot of their condition while they're out breeding the females. So it's important that they start off well conditioned so that they don't fall into that BCS of 1 when they end the breeding season. And to do this, and again, this is just a repeat, is you'll find some different, if you look up extension articles, any kind of textbook, it has, some different recommendations, and you can always talk with your nutritionist or your herd vet about what works best for your herd. But in general, about 4 to 6 weeks before breeding is usually adequate to kind of bulk them up, and about 6 to 8 pounds of forage and 1 to 2 pounds of a 12 to 14% crude protein concentrate. And when I talked about the male management, I did just want to put this out here is to make sure that we're monitoring them for pizzle rot. Anytime that we're feeding them extra protein, they're going to be at a risk for developing pizzle rot. So we definitely want to make sure that we're watching them appropriate and make sure we're monitoring and treating. And if they do start to develop that, do want to pull them off of that crude protein or at least decrease it. But then I also want to touch on the fact that we do want to condition them, but if we over condition them too much, it can also have detrimental consequences, which I did talk about before, but I wanted to pull up. I found a couple of studies that help to reiterate some of these points. So this is a study where they had 24 merino rams. So they were all about 2 months old, about 66 kilograms. Scrotal circumference was almost 32. And then their starting body condition at the beginning of this project, they were somewhere between a 3.2 and a 3.3 out of 5. And so basically what they did was the ones that were black were kind of the high diet. So that was designed to allow the animals to gain 10% of their live weight over the 65 days. And then on the other end, so this was more looking at this malnutrition effect where they were basically feeding them a low energy diet where they were trying to get them to lose weight, so about 10% loss. So again, if we're starting off at a 3.2 to 3.3, that's expecting that they might drop down into the twos, which obviously is not ideal. Whereas if we're kind of feeding them to bulk them up, they might bulk up to the fours, which is kind of what we might want to do. And then obviously comparing it with the gray, which is kind of just for them to be able to maintain their weight. And so you can see over here in this chart, and they did just that. So our males over here kind of maintain their body weight, whereas the ones that were fed the high diet increased. So you can see they all started about the same. So they increased in body mass, whereas the ones that were fed the 10% for a 10% loss decrease. So it did exactly what they were hoping for it to do, is what that shows. And so then they were looking at how did this affect, for one, scrotal circumference. So again, you can see here they all kind of started off the same, whereas the ones that were, fed to increase weight, increase. The ones that kind of just maintained their weight stayed about the same. And then the ones that were undernourished, they decreased in their scrotal circumference. So that's what both of those charts are showing. And this little pie graph is showing, or sorry, bar graph is showing that there was a significant difference between for the scrotal circumference between at day 65, the 10% gain versus the 10% loss. There was a significant change in that scrotal circumference. And then this chart over here, so these are just, I couldn't find their exact, just regular sperm motility, but these are sperm velocity parameters. So basically just showing how fast, all of these are just showing how fast the sperm are swimming, which is similar. They're usually strongly correlated with motility. So again, over here, you can see there was really, when we look at this little superscripts over here, the A's, when they're the same, that means there was no difference when they did their statistics. So you can see, again, in the undernourished group, all of the velocity parameters were decreased versus the ones that were either gained 10% or stayed the same. So there was not much changes in the sperm velocity parameters, which is what they were going for. And so this is Another study where they were basically showing the difference between doing an extensively managed group. So this is they were just out on natural pasture with a maintenance lick. And then this was what they called an intensively managed group where they got ad libitum diet in a pellet form. So not really a pasture situation. So most of their diet was getting fed as basically as much as they wanted in more of a concentrated form. And so what they ended up finding at the end of it with the scrotal circumference with the intensively managed group. So these are some interesting findings is that the scrotal circumference was higher in that intensively managed group, which we would assume to be a good thing. But what I want you to also focus on is when we talk about scrotal fat, it was significantly higher. So if we're talking about scrotal fat, so this is grams, so this is like how much like mass of fat there is. There's almost double in this intensively managed group, the scrotal fat. And I believe I've talked about this before. When you get a lot of scrotal fat, it's going to insulate those testicles and it's going to affect their ability to thermoregulate themselves. So this is not always ideal to have a lot of scrotal fat. So just because the scrotal circumference is bigger doesn't necessarily mean that everything fertility wise is going to be much better in these groups. So there's other things that we have to look for. And so this is another chart that they had on there. So they were looking at so here's the sperm motility parameters. So that I was talking about. So this is percentage. So how many sperm are motile? And so obviously 100% is kind of is ideal. You're never going to get 100%, but that's the gold standard. But minimum 70% usually is what we like to see, but 30% at least promising. But you look over here, the extensively managed group, 81%, which is awesome. And then you get to the intensively managed group, and they're all the way down to 51%. And again, you can see the A and B means that those are significantly different. So they were, even though the scrotal circumference was bigger in this intensively managed group, it looked like body condition wise, they were definitely, and I couldn't find that they actually said what the body condition changed to. They had the starting ones, but they didn't tell, I couldn't find where they had what they changed to. But if you look at this, or was it this? It might have been it might be on the next one. I think I might have it on the next slide, where we look at some other parameters that they have, but no difference. The good thing is that there was no difference in the percentage of normal sperm, but this takes 45 days to make these sperm. So I would guess that if they checked this semen quality in another 30 days or so, they might start to see some differences there. Um, and again, no differences in any of the other sperm mortality. Yeah, so this was the chart that I was looking for. So even though the sperm quality was different and the scrotal circumference was different, the big thing to note is the final body weight was obviously heavier in that intensively managed group. And their carcass grade, even though we don't have a actual body condition score, but the carcass grade was a lot higher. So showing that they kind of overdid it with this intensively managed group. So you can't just let them kind of like feed uncontrollably for 2 months beforehand. You do have to control it so that they don't get into I'm going to guess that these, like I said, we're probably getting up to a 5 body condition score, which is not ideal. Okay, so at this point, I should have a poll question coming up.
There
So,
you
what
go.
reproductive outcome can arise from overconditioning your ram or buck?
Okay. Do you want to give feedback?
Yep. It looks like everybody is paying attention. So we did talk about that decrease in the sperm motility that can occur from deposition of fat in the scrotal neck. So just a few things to point out. So increased libido due to excess energy was kind of a another one. I expected to have more maybe to kind of throw you off, but they could have some more excess energy, but that won't necessarily, under conditioning will definitely decrease their libido, but over conditioning won't necessarily increase it. In fact, if they're feeling kind of, winded or having a little bit of achy joints, it might actually decrease their energy there too. So I just wanted to kind of point out that. And obviously, I showed the one study where there was no change in the sperm morphology due to the scrotal circumference from the fat deposition. But I feel like over time that sperm morphology would probably decrease. So, and I don't think there's any effect on sperm concentrations that I've noticed in any of the studies. Okay.
Thank you.
Okay, so moving on to the females, and again, I've showed this chart before. So starting with our open, not lactating females, our desired condition's going to be around that too. They're, kind of not really doing much at this point, reproductive wise or energy wise. So we want to make sure that we're not letting them get to that over conditioned state. And then when we get to the period where we want to start preparing them for breeding, that's where we want them somewhere between that 2 and 3, because that's where they tend to respond the best if we want to do some nutritional flushing. And then once they get into that gestation period, we want them at that 3. And then sometimes somewhere between gestation and getting to a point where they're at lambing, somewhere between a 3 and 4 is going to be okay. So we want them to be at an adequate body condition score. Again, we don't want any, and you can see here, we don't want any of them at a 1 and we don't want any of them at a 5 at any point. And so this is just a reminder of the slide that I showed before about what nutritional flushing entails. And the whole goal of it is that we give them a big rush of energy right before breeding. And you do that by supplementing them. Again, you'll see different protocols. This is just the one that I usually recommend, the 0.14 kg to 0.45 of a 10 to 12% crude protein grain per head per day. And that can look like many different things. And you start about 2 weeks pre-breeding to really start affecting those follicular waves. And then you continue about 2 to 3 weeks into that breeding season. And so that's when that conceptus is going. So they've already ovulated, but you're trying to help promote growth of the developing conceptuses that are in there. So, and they do respond best with that marginal body condition. And so this is one of the studies that have showed that. So I wanted to just kind of show some of this data because I think it's interesting. So they had 180 does that they split into essentially 3 different groups. So they had a control group, and then they had, and all the groups are down here. I'm sorry, the little subtitles here are blocking them. But basically, this was like a protein only, and then this was a different energy requirement that they gave that also had this crude protein. And you can see kind of what this was all made up of over in table 2. And so what they looked at were starting off when the females had a high body condition versus those that had a low body condition. And you can see, and they broke it up here. So this is the SP or just our Spanish. And then F1s were about half Boer, half Spanish. And then the F2 were about 3/4 Boers and 1/4 Spanish. So you can see they even broke it up some breed wise, and there's some differences. If you look at pregnancy rate, there really wasn't any effect of when they had a high body condition score. There was really no effect of doing any of the nutritional flushing. Maybe with the F2 one, you saw a little bit of a decrease even, but I will point out that there's a lot of factors that can affect that. So maybe a little bit of a decrease with this one. Kidding rates, again, kind of just a little bit of all over the board. Again, if we're talking about the body condition scores, for whatever reason, it decreased with the protein only over here, but then it wasn't different. So for our Spanish ones, it wasn't different with this kind of combined feed here. When we go to the low body condition score, you definitely see a lot more interesting changes. So if we're comparing, again, the pregnancy rate, it looked like if we're looking at just the Spanish, we do have an increase from about 73% to 93% when you're just doing the protein. And then it actually it's like somewhere in between there when you're doing this mixture one. And same thing with the F1s and F2s. You see with both of those, you start to see increases in some of these. When we're looking at multiple birth weights, you definitely see pretty much across the board, except for some reason with the F1s, you definitely see increases in the multiple birth weights when you do any of these types of nutritional flushing with the low body condition. And again, it's kind of a little bit all across the board. Not much different between these, the Spanish ones between the control and the protein, but then they did get some increase over here. So all of that just to show is that there can be a lot of variability in how well this works. So don't be discouraged if you try it 1 year and it doesn't work with your does, even though it worked for your neighbor. You can always try tweaking a little bit, try tweaking what type of ingredients you're using, work with a nutritionist and see what works best specifically for your dose, because there's going to be a lot of individual variation based on how well the females are eating it. So if you've got, and especially, and we talk a lot about with does with this, but you can do it with ewes, but does are the worst for picking through things. So if you've got bullies in the group that tend to eat more than the others, that will affect your rates too. So you have to look at the big picture when you're trying to institute some kind of program like this. And then this was just another study that I thought was interesting because they did 3 different groups, a no supplementation, and then they did a 0.5% of body weight supplementation and a 1% of a supplement that contained corn, soybean meal, oat, lime, bicalcium, phosphate, mineral mixture, urea, yeast. And they did it 3 weeks before and then during meeting, and then it lasted for about 46 days. And so you can see here, body condition wise, they started them when they were about 2.8 out of 5. So, that seems to be an appropriate, I would say between 2 and 3. So that should be an appropriate for doing this type of program. But they didn't see with the supplementation, they didn't see any change in their body condition through it, which we would kind of expect because it's a short-term supplementation. But then when you look at the effects of the treatment, they're really, so we look at the p-values over here. So anything less than 0.0 or 0.05 is usually significant. So if you're looking at the lamb weaning weights, reproductive, or yeah, ewe efficiency, birth percentages, there was no difference there. And then this one, if I be quiet for a second, it might let you see this. So I'm just going to see if that will pull up if I not talk. No. Well, you guys can pull that up later, but this is showing the twinning percentage. So this is what we would call a tendency. So there was, as you got the 0.5% and the 1%, it does increase the twinning rate a little bit. So, so for this one, so this is obviously ewes. It did work a little bit better for weaning weights, but didn't really do much for the rest of pregnancy. And then this is showing another study from ewes that they divided the groups for adequate and restricted energy. So looking at the effects of kind of undernutrition. And so they did that for about 3 months of lactation. And then they did the nutritional flushing. So basically they found with this one, there were no significant effects in the nutritional treatment, whether or not they were at an adequate energy or restricted energy for 3 months. So even if they did flushing, they didn't find any effects on fecundity, litter size, or ovulation rates. The one finding that they did see was that so this is the restricted diet, so that's 70% diet with some nutritional flushing. And they found that they did have the onset of estrus when they were synchronizing them was at 7 days, and as opposed to the ones that had adequate diet and were flushed, adequate diet and controlled, or restricted diet and controlled. So those were all somewhere between about 11 and 12 days for estrus to occur. So just kind of another interesting finding that shows some differences. So you're going to see differences with breeds, farms, individual animals. Okay, and so I've got a poll question here.
Okay, let's go. You see question 2. There we go.
So, yeah. How does nutrition affect breeding success in the doe and ewe?
Interesting. Okay.
Okay, so looks like majority of you are paying attention. So our slightly underconditioned females respond better to our nutritional flushing and may be more likely to have twins. Notice that is may because there's a lot of factors, as I said. Um, Overconditioned females, I would say, A is not correct because overconditioned females are probably no more likely to get pregnant on the first service. And so that depends a little bit on how overconditioned they are. Slightly underconditioned female are more likely to not show heats. If that had said very under conditioned females or body condition score of 1 out of 5, so slightly under condition, I would say would be like your 2 out of 5, but they were definitely, if they were down to the ones, then I would say yes, unlikely to show heat. So, and then obviously this is just the opposite of what the correct answer was. So our over conditioned ones, does tend to not really respond much to nutritional uh flushing as compared to our under conditioned. All right. So, what are some other? So, those are all things that we've talked about before, but just went into a little bit more of depth to help you understand the nuances. So, other reasons that body condition score will relate to reproductive success. And this is where I wanted to cover late gestation nutrition. And this is why this is so important is 70 to 80% of our fetal growth is going to occur in the last 6 weeks of pregnancy. And so when we have an inadequate nutrition program, it's going to put us at a risk of periparturient diseases or diseases that occur in those last few weeks of pregnancy. It's going to lead to poor colostrum quality. It's going to lead to lower birth weights, lower energy reserves in the newborns, and ultimately it's going to be lead to increased death losses. And so the biggest thing we need to know is that concentrate feeding becomes really important in the last trimester of pregnancy because of both that increased metabolic demand that's occurring because of the fetus or fetuses and decreased abdominal space. And I think this doesn't get thought about quite enough is that the your ewes and your does simply cannot eat enough hay to sustain themselves because there's a finite amount of as those babies are growing and taking up space in that abdomen, there's a finite amount of space and something has to give. And usually it's the rumen that has to give. So as the babies are taking up space, there's less area for the rumen to fill. So they just can't eat enough hay to sustain even themselves, let alone due to this increase of 200% metabolic demand that's taking over. So that's why we have to start increasing our concentrate feeding. And so it's going to be somewhere between a third to 1 pound for goats or 3/4 to 2 pounds for sheep grain per day. And then obviously free choice, good quality hay. So if you give them really poor quality hay, again, it's going to increase that rumen fill and they're going to really struggle to meet that energy demand because they're just digesting, there's just fiber in there and not enough energy. So we want to make sure we're filling whatever finite space of room there is in the rumen with good quality hay and some concentrate. And where this goes back to is we want to, one of the biggest factors that can lead or determine how we manage these is quantity of fetuses. And I talked about in one of my previous talks about the use of ultrasonography to count the number of fetuses, which is certainly possible. And I also talked about the blood tests that can be used on farm that owners can get. And those are great and everything, but they do not tell you anything about the number of fetuses. So if you've had issues with pregnancy toxemia on your farm and triplets and quadruplets are pretty common, then usually ultrasonography is going to be useful to be able to determine how many babies are in there. Because those that do have triplets and quadruplets are going to be at a greater risk for developing diseases just because one, they're taking up more space, and two, they're increasing the metabolic demand that much more. And so their nutrition may need to be managed separately from the rest of the herd. And when I'm talking about these periparturient disorders, there's three main ones that our small ruminants get: pregnancy toxemia, hypocalcemia, and hypomagnesemia, which the latter two are a little bit, so these are kind of an order of commonality. So pregnancy toxemia is definitely the most common, followed by hypocalcemia, and luckily hypomagnesemia is not super common. Most people know how to manage to make sure they don't get that. So, and the biggest cause of this is they're failing to meet their nutritional requirements during late pregnancy and or early lactation. And the other big thing, especially between pregnancy toxemia and hypocalcemia, is these conditions can coexist. So, it doesn't have to be just one or the other. And for all of these, anorexia tends to be the first clinical sign. But as any farmer can tell you, if the animals are out on pasture or in a big group, you don't necessarily know right away that they're not eating well. So it sometimes it takes a while to pick up that they're not eating very well. So unless you're watching them closely, that tends to be a first clinical sign that is often missed. And when these disorders, especially all of and pretty much all of these, but again, mostly talking about pregnancy toxemia, it can be a significant cause of mortality, not just for the babies, but for the female too, if it's not diagnosed early and if it's not treated appropriately. So, if you've never heard of pregnancy toxemia, you might have heard of one of these terms. So, pregnancy ketosis, pregnancy disease, twinning disease, fatty liver syndrome, lambing, and kidding paralysis. So, those are all the different names that you might see for this disorder. And it's basically caused by the abnormal metabolism of carbohydrates and fats in the last trimester of pregnancy. And that's because, as I mentioned, due to rapid fetal growth and increase of metabolic demand from that. And so now we're producing a competition between the dam and fetuses for any glucose that is produced. Because about 30 to 40% of the glucose being produced from the dam is going to go to the fetus and placenta to maintain it. And basically, what happens with all of that is if they're using up all of their glucose, I won't get into, I cut out the slides from my student presentations about the Krebs cycle and all that because I won't go through that. But basically, they start to metabolize fat because there's a lot of adipose tissue usually available, especially when we talk about this obesity one I'm going to talk about here in a sec. When there's a lot of adipose tissue, that's what they start pulling from for energy. And when you start pulling if there's no carbohydrates, or glucose stores, when they start pulling from the fat deposits, they're going to produce ketone bodies, and that's when they become ketotic, and that makes them not feel well. And then it's just kind of a rolling cascade from there. And so, two different types of pregnancy toxemia. One is the obesity related, and this tends to be more of an individual animal problem. So, I feel like I see this one a lot more with our show animals or our pets. And it usually starts with your ewes or does that are starting with a BCS of somewhere between a 4 to 5. So, they're going to be the ones that are at the greatest risk. Cat. And um, the so I talked about that limited space of the rumen fill. So now we have adipose tissue also that is in the rumen that's taking up space. So not only do we have those growing babies that are limiting rumen fill, but we also have adipose tissue, and there's more adipose tissue that's available to be mobilized due to using up all of your glucose stores. And so basically, they decrease their feed intake, and then you can see things like hepatic lipidosis. So that's where their gums might turn a little bit yellow. And their blood glucose goes down and they become ketotic and don't feel good. The other one that we might see, this tends to be more of a herd-wide problem, is a starvation pregnancy toxemia. And the ewes and does are not fed appropriately during pregnancy, or they became pregnant while they were already under condition. And I see this a lot in people that just kind of have their animals just are out with males all the time and they don't really monitor them for breeding, so they don't really know when they're getting pregnant and they just kind of let everything go without managing it. And so, which obviously can be an issue. And it can happen with those that are carrying multiples, certainly this obesity one is definitely a bigger thing when there's multiples. The herd wide one can be multiples or singletons. Because it's more of a management issue. It can be also because the females are geriatric, so they might have poor dentition, they might have osteoarthritis, so they can't eat because of their teeth, or they can't get up and go to the feeders, or maybe there's too much competition with some of the younger females. Things like that. And similar with having concurrent diseases. So they've got severe pneumonia, they've got parasites, chronic wasting disease, hoof rot, anything like that that's limiting their ability or their will to get up and go eat or fight for food, that can be an issue too. And um, so this tends to be a problem that we just kind of see from mismanagement. And again, this is a different, just from a different article of showing again 2 to 2.5 for maintenance, up to 3 when you're breeding, and you kind of keep them there. And then yeah, 3 to here they're saying 3 to 3.5 by the time you get to lambing, and then once you're weaning them, they might drop down to 2 and to 2.5, which is also fine. So this is just showing those different scales. So some of the signs to look for, I already mentioned the anorexic. Once they stop eating, you might also notice that they're just kind of becoming dull, or you might notice they're not wanting to get up to go to the feeder near as often. And once it progresses, it gets to where they're down and listless. That's kind of pretty advanced, and that can progress pretty quickly over 3 to 4 days, where they're just down and they can't get up, or it takes a lot of motivation to get them up. Sometimes we'll see neurologic signs with it. So we'll see some head pressing, circling, muscle tremors, blindness, stargazing, which is what this little guy is doing over here, looking straight up, stumbling. And so it'll look like polio. If anybody's dealt with polio, they get these signs that look a lot like polio. And I think some of it's because they develop the polio second to it, because it has to do with kind of a dysbiosis in their rumen, which is similar to what we see with polio. You might also see some difficulty breathing, teeth grinding, excessive salivation, excessive licking. Again, those are kind of all neuro signs and discomfort signs too. And so when we're diagnosing it, so most owners, if they call me and tell me they have a late pregnant ewe or late pregnant doe that's down, most of the time that's pretty indicative of a pregnancy toxemia. And I do have a lot of owners that you can buy these urine ketone sticks, and we definitely have cow owners, dairy cow owners that do this on their own, but I do have some sheep owners that will monitor urine ketones themselves to check for this. If you're able to get blood, a blood ketone meter is about the gold standard. So otherwise, this is something your vet can usually check to see, to confirm that there is a ketosis present. But basically, if there's any urine in the ketones, then that's indicative and diagnostic of a pregnancy toxemia also. And so treatment at home is going to be giving propylene glycol, and you can find a lot of this information again online, any extension articles, and through your vet. But somewhere between 60 to 200 mils of propylene glycol tends to be the gold standard. You can do it every 6 to 12 hours for up to 6 days. And the longer you go and the higher doses will disrupt that ruminal flora. So at the end of the treating, you may need to do something like a cud transfer, where you take the cud from a healthy sheep and give it to this one to give them some good rumen microbes. Or if your veterinarian has access to a cow, you can actually get some transphonate from a cow to give to your sheep. We have a cannulated cow that or a few of them that we have access to, that we will do it for obviously for cows, but we do it for small ruminants also if you don't have access to other small ruminants. There's also, this is available over the counter. Many of you have probably used it for a variety of reasons, but NutriDrench, that actually has propylene glycol in it. It's also got some molasses and vitamins and stuff in it. And the label says, for treating pregnancy toxemia. So this is certainly something that you can try for a few days to see if it helps, rather than just giving straight propylene glycol. Some other ones that when I was making a similar lecture to this for my vet students, I was just kind of looking up some other things. And so this Lectade liquid, it's basically just like an oral glucose drench. which I had always been taught that anything like if you ever give glucose orally to ruminants, it just gets broken down in the rumen, which is why we have to do the propylene glycol because it gives them the source to make their own glucose. But this one actually in the study, this was a study from 1986, and there's not really been anything recently. They found that if they gave 160 mils per U every 48 hours, they had a 98 or 90% recovery rate in mild cases and 55% recovery in severe cases of ketosis. So it's kind of interesting of something, it's more of a small, like a dog product, but seemed to work well. And then we always want to make sure we're also addressing dehydration as well if they haven't been drinking well. So giving them some electrolytes. So I like Enterolite, that anything that's made for calves because it usually has a little bit of buffering in it too for acidosis, which these girls are usually quite prone to. And then something that you'll probably, if you haven't already seen it or tried it, you're gonna see this on the listservs growing more and more popularity. This is the only study I know of that's been done of looking at wine for treating ketosis, but it was in cows and they did it over in Italy and it's been pretty popular. But I've seen a lot of people talking about using it in small ruminants. I unfortunately don't have any doses to give you for it. But you can certainly look this up online and see what people have used. And they don't really know. It's got to be the cheapest boxed wine, and it's got to be red wine that you can get. It can't be anything expensive, for whatever reason. That's what I've been told. So, but basically, they found that when they used wine, so BHBA means this is that blood ketone monitor. So when they were looking at with wine, so before treating, it was 1.39, and after treating, it was 0.98, which was actually better than when they treated with just the propylene glycol. And you'll see they also compared it with ethanol to see if that was the component of wine. And with the ethanol, there was actually no improvement. So they don't really know what's in this wine that helps, but it does. And some people seem to think it doesn't cause quite as much dysbiosis in the rumen as like propylene glycol does. So there's something I'd like to study in the future, but I think some people might already be beating me to it as a treatment. So that's pretty easy to obtain. And if you get to these cases that are really severe, especially if you've been treating them for a couple of days, call the vet because these can go downhill really fast and be prepared for the options that they're going to give you. And so the options are they can just treat with some IV, probably a combination of IV and oral fluid drenches on farm and just kind of monitoring to see if she improves. Treatment with IV fluids on farm and then inducing parturition. So this is where knowing those breeding dates can be really helpful. Depending on if they ultrasound and see what the fetuses look like, an emergency C-section might be needed. Referral for hospitalization. So if it's something, if the female's really bad off, but you really want to try to keep her going for the sake of the babies to get them to more of a mature state, then going somewhere like, we at Virginia Tech will take these and, any hospital that will take care of them, 24-hour care, mostly university hospitals for large animal. That might be a possibility. And then, when they're in really bad shape, euthanasia can always be an option. If you can't afford treatment and she's in really bad shape, or if the prognosis is just poor because of how she looks. So don't feel like that's not an unreasonable option. So we can give our animals a dignified death when we need to. And so prevention is going to be identifying our at-risk females. Some people check for ketones with the urine strips in the last month. And if you've got big groups of animals, you can group them according to the BCS to feed them a little bit differently. And again, I gave you some options earlier. If you've got females that are a little bit high risk, you can top dress them with a little bit higher energy supplementary feed. You can, again, always high quality hay and concentrate. Some people do propionic salts. Again, that's kind of a precursor for the rumen. So that's always an option to give to females in the last trimester. And again, I'm not a nutritionist, but I put these slides in here because this is from a really good nutrition article, and I've got the link for it down here if you are able to get access. But basically, nutrient balance is a function of dry matter intake and dietary nutrient composition, which just means how much they eat and what that feed consists of. So with that dry matter intake decreasing in late gestation, you need to make sure you're modifying the density of that nutrition to make sure that they can get the adequate nutrition. So, and that's pretty much everything that I've been saying, just in fancier terms. So increasing that grain amount is going to be really important. And you need to do it slowly. We never just want to start throwing high amounts of grain at them. So you want to make sure that the microbes in the rumen are happy. So you're introducing it slowly in that last few months of pregnancy. And then the other thing, and again, I'm not a nutritionist, so you can kind of read these and determine what it all means to you. But there's a lot of different things that will regulate that dry matter intake. So forage maturity is one of them. So if you've got forages that are exceeding 55% of that neutral detergent fiber, it should not be fed to late pregnant ewes and does, because you want to limit how much is going in. And you need to make sure that you're seeing how much of intake that they're taking so that you can adjust the energy and protein that you're giving them. And if you can't access this article, I could always download it. It was a very nice article by Dr. Van Son out of he's in Pennsylvania, and a very brilliant nutritionist. So he's definitely the one that I recommend talking to. Um, and then I think I've got one more poll question.
Yes. Yeah, this is the last one. There we
All
go.
right. So we've got a couple of scenarios here. Which female is at an increased risk for developing pregnancy toxemia during late gestation?
Interesting scenarios.
And I've seen pretty much all of these scenarios.
Okay, there you go.
So pretty much every answer is correct. D being the most correct because all of the above are at risk for developing pregnancy toxemia. So we talked about kind of that starvation pregnancy toxemia. I've had this actually. It was in a goat before that had a really heavy parasite burden and a 1 out of 5 body condition score that presented with it. I also have had the Bordeaux that had a 5 out of 5 body condition score and had triplets. That one was an emergency C-section, and unfortunately, only one baby survived. And then elderly mixed breed doe of normal body condition. So this one was meant to kind of throw everybody off a little bit. But if she's got severe arthritis, we talked about that as being a contributing factor of her being able to get up and feed. So she is at an increased risk for developing it just because she does have that arthritis and she's elderly, even though her body condition score is normal. So all of these were correct answers. Okay. And so just kind of the last few slides I have here are other considerations is anytime we've got poor nutritional management, other things we're going to be concerned about is additional periparturient or postpartum disorders. So I talked about hypocalcemia, hypomagnesemia is another one. They get all of their magnesium from orally, so it has to be in the diet to not develop this. But other things we might think of, vaginal prolapse and uterine prolapse, vaginal prolapse, we see an increased amount of those when animals are overconditioned. And with uterine prolapse, that's usually associated with them having hypocalcemia and sometimes being a little bit underconditioned also. So all of that can be related. We've also worth noting that overconditioned or underconditioned females are at an increased risk for dystocia. Again, when there's a lot of fat, intra-abdominal fat, sometimes it limits the amount of room for the babies to actually, if it's up all the way up to the pelvis, it limits the amount of room for the babies to enter the birth canal. So, and then underconditioned females are just at an increased risk just because of the sheer energy it takes to give birth. So they might be at an increased risk just because they don't have the energy to push when the time comes. And then colostrum, I mentioned this a little bit earlier, colostrum quality may likely be affected. So we always want to make sure, and we should do this even if it's a healthy birth, is that we're always checking the udders and making sure that they're producing milk and that it looks like it's of good quality, it's nice and thick, especially for that colostrum because they need to get that the babies need to get that colostrum within the first 24 hours. So, and if they're especially under conditioned, we definitely want to over condition. They usually make okay colostrum unless they had pregnancy toxemia. But under condition, we definitely want to check for that. And then fetal programming effects, which is probably a talk all on its own. And I did come across a few different articles that showed some effects of restricted versus intensive type diets and the effects on the developing fetus when the developing fetus became a ewe lamb when that one started cycling. So there are effects that you can have when you're talking about the next generation. And I'm not going to go into that today because, like I said, that can be a whole different talk. But just something to keep in mind when you're talking about, you know, breeding farms and breeding stock that you're going to be keeping around. Okay, and at this point, I am happy to take any questions.
So for the people that have questions, you can write in the chat.
Um, so there are total 9 questions that have been asked. So one of the question is, we have a dose with a body condition of 5, and how can we, so it's a in a herd, and how can you put a single goat within a herd in a diet that help to lose weight? It's kind of very hard question, I believe.
That is a very hard question, and obviously you don't want to separate them because that's even more stressful. But I have seen people that have do the muzzles on them
Mhm.
and have like they do with horses. I mean, that's kind of what they do with them. So that's really the only good answer I've come up with before for some of these that don't require separating the animal off. If you've got a few of them that you can separate off together and do some more individual feeding, you can do that. But yeah, there's no good answer. It just depends what I guess would work for you. But
Sure. So the next question is, do you have a recommendation for good concentration feeding by weight, by body weight, or during late gestation nutrition?
um do I have any just like specific protocols? Because I
Mm,
had a couple in my PowerPoint, but a lot of it's just gonna I don't have any that's specifically by body weight. So I think you just kind of have to go mostly by body condition, but also it's gonna depend a lot on what type of feed you get. And so that would be something that I would work with your individual, either your herd vet or your nutrition if you've got a nutritionist to work with. Um, those would be the sources I would go for that because it's going to depend a lot on your herd and what their body condition already is.
So this question answer some of the answers are already covered, but I will just repeat the questions. What is the treatment for pregnancy toxemia, hypocalcemia, and hypomagnesemia?
Yeah, so I covered pregnancy toxemia, so hopefully that answered some of your questions. For hypocalcemia and hypomagnesemia, pretty much the treatment for both of those are IV calcium and IV magnesium, respectively. So for both of those, they tend to be pretty emergent. I had to cut all that in. I had some of that information, and obviously it was going to be much too long. So, but you basically call the vet for either of those because they occur really quickly and they can a lot quicker than pregnancy toxemia, and they usually need IV treatment. Now, there are different preventative measures that you can get that you can do that involve giving oral or sub-Q calcium if you think they're at risk. And then obviously with magnesium, their primary source of magnesium is going to be ingesting it. So making sure that they've got magnesium supplement in the diet is going to be good for preventing that.
So another question is, what are your thoughts on red wine instead of polypropylene glycol?
I've heard, I have not tried red wine myself, and I have not recommended it myself.
Sure.
Just because I'm in a university and I don't really have access, like we can't really carry it around on our trucks. But from what I've talked with people, a lot of people have liked it instead of propylene glycol. So I don't know if there's any anybody that's looked at using them together and seeing how they work in conjunction. But as far as I know, it can be used as an alternative to propylene glycol, not necessarily with it. Although I
Sure,
don't think it would hurt to do both.
sure. So this question is regarding to alternative to the cord transfer. So what are your thoughts on using fecal, using some pellets from healthy goats and sorry, healthy sheep and using those in a cheesecloth, strain those and drains to the animal?
I have never done fecal tea, or suggested it. I don't even know if I've heard of it before. So I guess my initial thoughts are, um, yeah, I would have to do a little bit more of looking for it because when we talk about like, so it works for rabbits because they're hindgut fermenters. So all that fermentation that occurs after it goes through the glandular stomach, but it's the opposite for ruminants where everything ferments and then it goes through the glandular stomach and breaks down and then goes through the tract. So I don't know how well it would work just because of the
Yes, sir.
because most of the microbes are going to be dead by then. So
Yeah,
I don't think it would work as a good alternative to cut transfer.
absolutely. So these are those two are totally different things. So another question is ketosis genetic? Is
Is what?
ketosis is ketosis
Oh,
genetic?
so the ketosis issue, there can be genetic components to it. So I have seen that there's certain females that year after year tend to get ketosis within a herd. And some of that just might be like how her metabolism is in general. Some of it might be the fact that she's just prone to having triplets or quads each year. So there is some, I don't think ketosis itself is necessarily genetic, except the predisposing factors tend to be, yes.
Sure. Um, Thank you for your question. So another question is any suggestions to make nutri drains more palatable, more acceptable? Nutri drains. So is there
Yeah.
any way to make nutri drains more acceptable?
I would just say getting the good drencher guns that go into the back of their throat, so
Mhm.
that they're less likely to spit it up. So yeah, some people will, I mean, with other drugs, sometimes put a little like it does, and it does have some, I believe, some molasses in it. So you could always try to put a little more molasses in it. But yeah, I would say the drenching guns that go to the back of their throat rather than I don't know if you're using just a syringe or if you're using one of those drenching guns, but that would help because it kind of forces them to swallow it.
Sure. So do you have a book recommendation for nutrition?
No, but I can look up, I can try to see if maybe I can find some kind of paper or something from like the one that the kind of excerpts from Dr. Van Son's. I can look and see if I've got something. It's a very um it's a very wide subject, so it's and obviously there's
Sure.
a lot of nuances with it, but I can see what I can find and maybe send it with my PowerPoint.
Sure. There are last few questions in the chat box. Maybe you can see some of those last 4 or 5 questions I might have
Okay.
missed.
Let's see. Um
Yeah, they were asking the doses for the wine.
Yeah, I can't remember the doses of the wine. Because it's just more been like me discussing it with people who've tried it. So I mentioned the chronic wasting disease. So more so in regards to things like ORF or CAE, which are similar to the chronic wasting disease for the deer virus, is more what I was talking about with that one. Um, let's see. Um, You mentioned discussing pregnancy toxemia prevention to feed high fat supplements. So, did you mean to feed high fat does did you mean feed high fat does at risk who had high BCS or those at risk with low BCS? Um, so discussing to feed high fat. So that would be either of them. So it because they're all kind of at risk. Even if they're fat, you still need to increase their energy in that period because they're still going to be at risk. So you don't want them to go into that ketosis. And someone mentioned, oh, Power Punch. Yeah, I've heard a lot of people. I haven't used Power Punch, but I've heard a lot of people that like that as a similar option. And then, which dose are most risk for hypoglycemia and may benefit from oral calcium supplements? Tums and calcium gel, yes, I do recommend those. I always think those are actually really useful. I've heard a lot of people that I've recommended Tums a lot, and people seem to think it works really well. The dose most at risk, definitely, your dairy does. Are going to be more at risk kind of after giving birth, whereas your non-dairy breeds are going to be before. And I don't know if there's any big risk factors besides pregnancy toxemia is going to predispose them to getting hypocalcemia. So that's definitely something that about I feel like 30% of cases we see both of those. So let's say I feel like I've gotten
Yeah.
most of them here.
Well, and it's just on time. Yeah, thank you so much. I think it was so excellent, so good presentation, and just to keep in mind that concept that you were saying, Dr. Bounds. So accordingly to the requirement, nutritional requirement, you have the supplemental. So I was thinking just for that Spanish and the F1, F2 with Boer crossbreeds. So they have like the birth weight were like a heavier, and also they had more kids per dog, so they were increasing the requirements. So even they have like a uh, any condition, but they were the same supplement. So it's like you are like crossing with some lactating dairy animals they use, or the dogs, they would require more supplement. So, and one of the things that we have found as extension people is that not many farmers they have a good hay during the winter, so that make worse the situation of nutrition. So we made advice also for the people to go to the YouTube channel. We have from some other years some talks about nutrition and during the winter, so also can help. But it's so great what you presented today, Dr. Stewart. Thank you so much. I think it's what we need. It's what the farmers are asking, to know deeper knowledge about what is happening with the animals. So we appreciate, and we are expecting for the next talk next Monday, 4 o'clock Central Time.
Yep.
Thank you.
Yeah, thank you so much, Dr. Stewart. I so much information, and you were able to answer so many diverse questions, very different type of questions. Mhm.
Okay, see you then.
Yeah,
Thank
thank
you.
you.